Hi everyone, in this lecture I will be going over research hierarchies. As we're searching for research, we're going to encounter a bunch of different kinds of research, and I'm going to introduce you to different ways that you can start to look at the study and determine which one is going to be the most effective for the particular question that you have and what type of answers you're hoping to get. So there are two ways of ranking research studies. First is the research side, okay? And in this case, the research, the value of the research depends on the relevance of this particular article to your specific question. So you could have, for example, an article that's amazingly done and it's rigorous and it's got a random sample and a control group, and it's in terms of the evidence, it's really great, but it doesn't apply to your particular research question. So in that case, it would get ranked really low in the research hierarchy, okay? And because what's important here is that the research applies to the question you are trying to answer. So for example, if you're interested in treatments for depression, a meta-analysis that combines lots of different articles about treatment, summarizes them, and presents you with collective findings is going to be really high on your research hierarchy, while something that talks about anxiety, for example, a random control trial for anxiety is going to be really low because it has nothing to do with your particular research question. Okay, now on the other side of that is the evidentiary hierarchy. And in this case, the value depends on the rigor and logic of the research design and the consequent validity and conclusiveness of the answers that it's going to produce for you. Here, we're strictly concerned with how empirically strong the study is, not necessarily how relevant it is to your particular question. So in this case, a study that's experimental and has a lot of control that's in place and random sampling is really going to help with its validity and reliability, and is going to be considered quite high on the evidentiary hierarchy. For our purposes as clinicians, however, this is problematic because you don't get a lot of studies that are true experiments or true randomized controlled trials for therapy treatments. And we'll talk about reasons for why that is later. So for the majority of the work that you do in this class, you're going to be focused primarily on the research hierarchy and where that article lands. But at the same time, you still need to make sure that that study is still rigorous enough and high enough in the evidentiary hierarchy that it's not just going to be like something you found on Wikipedia, right? Okay, so we're going to look at a couple of questions that you might be seeking to answer in this class, and then what type of research you might draw from in order to answer those questions. Okay. So question number one is, which factors best predict outcomes, desirable or undesirable? Breaking down this question a little bit more, this is basically asking which circumstances or attributes best predict prognosis or risk. We're not asking about effectiveness of a certain intervention in this case. So here you're probably going to be looking at correlational studies, for example, a case control design. And these are going to tell you when there are relationships or relations between a certain characteristic, attribute, circumstance, and the outcome that you're looking at. Okay, so for example, if we were looking at a study of foster care placements and we wanted to know what distinguishes successful versus unsuccessful placements for foster kids, maybe we're going to get a large sample of foster care placements from case records, and then divide them into successful and unsuccessful and try to see what the differences are between the two. And so this would be a correlational study. And maybe we'll find that gender matters or race matters or something like that. Okay, and so this would indicate that this is totally not research-based, but maybe that like matching foster child and foster parents' race ethnicity is a predictor of successful outcome, right? So that's what this would be looking at. You could also do a qualitative assessment. So remember, qualitative studies are things like interviews, focus groups, record keeping, observation, and so on. And so for the same thing with foster care placement, maybe you're going to bring in a group of foster children and a group of foster parents and determine what made their placements successful versus unsuccessful through a focus group. Okay, now you may be asking, well, why not an experiment? Experiments are the gold standard and they're going to provide us the most unbiased results. But remember that in this case, you got to consider what's ethical, right? And so in order to do an experiment, you'd need to randomly assign certain children and certain parents to the successful group, which means you have to then assign the rest of them to the unsuccessful group. And that's unethical, right? You're not going to put, okay, here you go, child, you're going to go into the home that's going to fail, right? That's just not going to work. And so it's difficult to find experiments that address mental health issues and answer this question. So we're going to be looking more so at quasi-experiments or correlational studies and qualitative assessments. Okay. All right, let's look at another question. Another common question that we'll get related to mental health is, what can I learn about clients, service delivery, and targets of intervention from the experience of others? Which basically means we're wanting to describe and understand someone's experience and what it's like to walk in their shoes, so that you can then make the next person or next group's experience more positive. So in this case, we're going to be looking primarily at qualitative studies. Remember, again, interviews, focus groups, observations, and so on. Because this particular type of information is really difficult, if not impossible, to gather using quantitative research. It's hard to capture all the range of experiences someone might have had in something like a survey or a really strongly structured interview, right? You'd have to come up with a lot of questions to really understand someone's experience of something, right? And why they had that experience. So a qualitative study is going to be really helpful here. So an example might be if you were to want to understand the experience of homelessness, right? And risks that have to be taken when you're homeless. Maybe you're going to immerse yourself in a homeless encampment, for example, for an extended period of time and gather observations and interview individuals there and really find out firsthand what is the experience, right? And so this will get you a lot more rich data than using something like a survey where the information might be skewed into what you already believe homelessness is like, right? Or just might be really, not descriptive enough, right? Not anything new or helpful would necessarily come from something like that. Okay. Question number 3. Which assessment tools should be used? We talked about this in lecture 1, I believe, when we were talking about using evidence-based practice in assessment. Okay, so here we're looking at which instrument or assessment tool is going to be the most reliable, valid, sensitive, feasible, and culturally appropriate. Okay, so with reliability, we want to know that the same scale is going to give us reliable results. So if you were to administer a scale twice in a short period to a large sample and then test to see the retest reliability, you're going to want to see that they're pretty reliable, meaning that they're pretty similar from one point to the next, right? If there was a short enough time and not many things have changed. So it would be odd if you administered to your client a depression scale at the beginning of the session, every day, every time you have a session, and their changes are drastic, right? They come in the first session and they have a depression score of 30 or something. And then you see them the next day to keep doing your assessment, and now their assessment score is 0. Like, that does not seem reliable. Yes, it's normal to have a little bit of change, especially as you're doing therapy, but to jump that dramatically indicates there's a problem with reliability of that measure, okay? With validity, we're wanting to make sure that the measure is actually measuring what we want it to, okay? So if you're administering a depression scale and there are questions in there about, I don't know, having nightmares and flashbacks, well, that's not necessarily something we'd think of with depression. So is this really a valid measure of depression, right? So those are things you'd want to consider. You'd look at the questions that are being asked. With sensitivity, we want it to pick up differences. So if you administer a questionnaire at the beginning of therapy and then, in the next quarter, say 3 months later, you re-administer it, you want it to pick up on changes that are happening, right? You want it to show that a change has occurred between the beginning of treatment and 3 months later, okay? So in this case, when you are looking at a study and trying to determine whether you should use this specific assessment tool, you're going to want to look for those things. And you're also going to want to look and see that the tool has been used with clients that are similar to your client, right? If the tool has only ever been tested among females and your client is male, this tool probably shouldn't be used, right? And so those are answers that that's information that you're looking for as you're assessing and trying to answer this question. Okay, next. Our next question is the most commonly asked question in terms of mental health, and that's which intervention, program, or policy has the best effects? This is where we get to the efficacy of treatment question. And so, of course, experimental designs are the gold standard for determining whether a particular intervention, and not some alternative explanation, is the real cause of a particular outcome. Experimental design has 3 essential features shown here. So first, there's random assignment, okay? So you can see there's a large population and folks are randomly selected from that population, okay? And that creates a random sample. And then you're going to have a control group. So from that now random sample, you're going to split them in half, again, randomly, so that you have a control group that does not receive any treatment, and then a treatment group that receives the treatment, okay? This is going to make it so that any differences that exist between the groups are because of your grouping and not because of differences that were already present in the groups that you've used. Right? It's not just because you selected all of the women to go into the control group and all of the men to go into the treatment group. And so it's a gender difference, right? Everything is random. So any differences you see are thought to be because of the treatment that you've administered. To make this even better, you would have a pre and post test, okay? And so this is where you would administer say a set of scales, Beck Depression Inventory, PHQ-9, whatever, at the very beginning of the study, before any intervention happens, and you would get those scores. And then your control group gets nothing, and your treatment group gets the treatment, say CBT. And then at the end of that treatment period, everyone does those same scales from the beginning all over again, and you can compare differences. And so this would show you, hopefully, that your treatment is effective, so the scores are better in the treatment group, whereas the scores in the control group should likely not have changed very much. Okay, and so this is the best, right? So you may ask yourself, well, then why don't we use this all the time? This seems great, you know, so we can know exactly what is effective for every mental health disorder. The issue is sometimes this is not feasible. It's not possible to do, right? But probably more so, it's unethical, right? Consider a study on like prenatal alcohol exposure. You're not going to randomly assign a group of mothers to the alcohol condition, right? That's totally unethical, right? And then the other thing is, even if you're just saying, okay, well, you know, you don't get treatment and then this group gets treatment for like something like depression, like you get therapy and the other group doesn't, you may be thinking, oh, well, that doesn't necessarily do harm. But if it were you that's depressed and that needs the treatment, would you be happy to go into the no treatment group? Right? No, and that wouldn't be ethical. That could be doing harm, right? What happens if all of your participants in the no treatment group then go and commit suicide because they didn't get treatment, right? So that's the main issue we have in terms of mental health with doing experiments. So instead of doing experiments, we do the next best thing, which is a quasi-experiment. And in this case, it basically has the same features of an experiment, a true experiment, but it doesn't have random assignment, and the control group might not actually be a full control, meaning a no treatment group. And so you could assign people, even if you did it randomly, you could assign people, right? But instead of the second group having no treatment, they might have what's called treatment as usual. So they'll go and do regular therapy while the other group does this new different type of therapy, right? So maybe one group gets CBT, but now the treatment group is going to get CBT plus exercise or something like that. Okay, and you're going to see the difference there. And so it's a slight difference. It does make it so that it's not a true experiment, but the results are still very strong and very informative, okay? The next thing that you could do is a correlational study. And this, again, remember, relies on statistical associations, and it can give you some preliminary information about the effects of different interventions. And so this is what you see with large scale studies that are using like a national sample and asking them all the same questions in order to figure out patterns, right? So an example might be if you ask students in a bunch of different high schools about sex education and sex practices, right? Or for example, for my dissertation, I used the National Survey of Children's Health to look at different things related to young children, right? Obviously, there's lots of limitations to this research. You don't have a lot of control over the questions that are being asked in some cases, like with mine. You can't say this causes this. You can just say there's a relation. And so that's a big limitation. And in terms of mental health, it might not provide the type of information that we're looking for. It could give you things like prevalences, right? How prevalent is depression among 18-year-old females or something like that. But to go as far as to say, you know, DBT is an effective treatment for anxiety, we can't really do that with correlations. And then we can also use systematic reviews and meta-analyses. And remember, these are analyzing a large grouping of studies to see what their results were collectively. Okay. A meta-analysis is usually a part of a systematic review that combines the statistical findings of different studies in order to assess the effectiveness of a particular intervention. So basically, they're calculating the average strength of an intervention's effects in light of the effect strength reported in each individual study to give you a larger scale, perhaps more generalizable finding, okay? And so some of these are going to look at different interventions for the same problem. So maybe they're going to look at, you know, all the different interventions for depression and then see, based on all of the articles they looked at, which one of these different interventions seems to be the most effective, right? These are very helpful, especially if you're new to the particular topic, because they're going to synthesize lots of research, and you could then use their reference list to find more individual studies, okay? But this isn't any new data collection. And so if you're looking for new data and you want maybe like emerging information or like brand new research, these are not going to be that helpful, right? Because they're gathering data for, say, the past 10 years or something like that from studies that have already been completed, not gathering new participants and running new studies. So that's a big difference. But each of these quasi-experiments, correlational studies, and these reviews and analyses, they each offer some helpful information to answer this question of which intervention has the best effects, since we can't normally get straight up experiments. And so you'll find yourself using a lot of these, and you just need to keep in mind that while these may be really high on the research hierarchy, and in terms of evidence, they're always going to be below, in terms of the evidentiary hierarchy, they're always going to be below a experiment, okay? All right, so that is it. And as you go and begin reading your articles, it can be helpful to ask yourself, number one, is this addressing the question that I have, meaning that it's high on the research hierarchy? And number two, how rigorous is the design, right? How strong is it? And with that, how strong are the results, and how seriously can I take them, I suppose you could think about, and that will be the evidentiary. Okay, so we'll talk more about these, and I'm also happy to help you kind of figure out where a particular article lands as you do your research. So let's discuss more in class. All right, thank you for listening.